Mental health progress notes are the primary documentation substrate payers review to determine medical necessity and reimbursement. Write them poorly, and you lose the claim. Write them well, and they defend medical necessity through every level of payer review. In this guide, what progress notes must include, the 3 formats payers accept, the ICD-10 and CPT codes that belong in every note, and how the right software cuts denials. What they are: SOAP versus DAP versus Freeform, code matching rules that prevent denials, the 5-stage billing workflow, and how behavehealth.com supports it all. So what exactly is a mental health progress note? It is the clinical document that records what happened in a therapy session, observations, interventions used, the client's response, and the plan for next steps. Notes track the client's movement toward treatment goals and create a continuous record across providers. They are part of the official medical record and can be subpoenaed in legal proceedings. Accuracy and timeliness are not optional. Here is the cost of weak documentation reality your billing team deals with on denied claims. A mismatch between the ICD-10 code in the progress note and the active diagnosis on the treatment plan is one of the most common reasons for denial. Notes that are too short often fail medical necessity review at the payer level. Notes padded with boilerplate language trigger audit flags for copy-paste documentation. Behavioral health teams use 3 main progress note formats. The choice depends on state requirements, payer contracts, and clinical preference. Let us walk through all 3. Format 1. SOAP, Subjective, Objective, Assessment, Plan. Subjective captures what the client reports about their own experience in their own words. Objective documents what the clinician observes: presentation, affect, behavior. Assessment is the clinician's interpretation of current status and progress toward treatment goals. Plan outlines future treatment direction and interventions. Format 2. DAP, Data, Assessment, Plan. Data merges subjective and objective information into a single section, streamlining the structure. Assessment is the clinician's interpretation of the combined data, clinical picture, and progress. Plan sets the next treatment steps. DAP is widely used in SUD and IOP settings where speed matters. Format 3. Freeform. Freeform notes allow narrative flexibility, useful for complex cases or modalities that do not map cleanly to SOAP or DAP. Whatever format you use, the note must document the intervention, the client's response, and the next step plan to pass medical necessity review. Every reimbursable progress note needs an ICD-10 anchor that matches the active diagnosis on the treatment plan. F41.1 is the highest volume ICD-10 code in behavioral health. A GAD-7 score in the note is the most defensible evidence of medical necessity for F41.1 sessions. F41.9 is the most searched unspecified anxiety code. Use it when the presentation does not yet meet GAD criteria. F32 and F33 cover single episode and recurrent major depression. Avoid overusing .9 unspecified codes. Payer audits flag them as markers of inadequate diagnostic rigor. For F11.20, uncomplicated opioid dependence, the note must reflect the current state, active use, early remission, or sustained remission, because that status drives level of care authorization. Progress notes determine which CPT code gets billed. Time documentation is non-negotiable for every time-based code. Every time-based CPT code requires the session's start and stop times, or a clear time statement in the note. Payers increasingly audit 90837 for overuse. The note must justify why the session required 53 or more minutes. For 96127, document the instrument name, raw score, interpretation band, and clinical action taken in response. A clean progress note is the first link in the revenue cycle. Here is how the 5 stages connect documentation to reimbursement. The clinician completes the note. ICD-10 and CPT codes populate the claim, and the billing team verifies the combination before submission. Payer denials often cite missing medical necessity detail. The progress note is the first thing the appeals team reaches for. Notes that show measurable progress, clinical complexity, and level of care justification win appeals. Documentation quality is a revenue issue. BehaveHealth.com is designed to help your team produce notes that pass medical necessity review on first submission. BehaveHealth.com supports SOAP, DAP, and Freeform notes. Clinicians document in the format that fits their program. The Behave AI Assistant generates structured first drafts from session content, reducing documentation time without sacrificing specificity. Built-in error checking scans for blank fields, timing inconsistencies, and denial risk details before the note is signed. Notes are integrated with treatment planning, scheduling, and billing, so the ICD-10 code on the note and the claims stay in sync. Stop losing claims to documentation denials. Book a 20-minute demo and see how behavehealth.com is designed to help. See the progress note workflow, templates, AI drafting, error checking, and billing integration in a 20-minute demo at behavehealth.com.